The Northwest Law and Mental Health Conference brings together expert speakers with legal, clinical, and lived experience to discuss the impact of the law on people with mental illness and addiction. Our spring 2020 conference was postponed due to COVID-19, so presenters recorded their sessions, which are now embedded in the conference website along with their collateral information. Thanks to all our expert presenters, generous sponsors, exhibitors, volunteers, and the planning committee for the Northwest Law and Mental Health Conference. Stay well, and we hope to see you in 2021. I'm with Ebony Clarke LCSW of Multnomah County. She's the head of the Behavioral Health Division and responsible for Multnomah County's work with folks with mental illness and addiction. Ebony, tell us a little bit about your background and tell us what's going on now in these times of COVID-19.
Yeah, so I'll just take a minute just to let folks know who I am. I appreciate being able to take a minute to share a little bit about my background, just because I think oftentimes it's our background that drives the passion for the work that we do. So, I am the director of the Behavioral Health Division at Multnomah County. I've been with the county for about 10 years. Prior to joining the county, I was the service director for LifeWorks Northwest, where I was over all of the child and adolescent outpatient mental health services and prevention services, in addition to the culturally specific addiction services and mental health services. And so I was there before I joined the county. When I came to the county, I was the senior manager initially for all of the children and youth services. So was over school-based mental health, ESA, early childhood, the CARES Northwest program, and care coordination. And then moved up to the deputy director position in 2014, and recently was promoted in 2018 to the director of the division. Just backing up a little bit, I think it's important to let folks know that I am a native to Portland and to Oregon. Just a small snippet about myself, and there's lots of stories out there, so I figure I'd go ahead and share this. I was actually born drug affected. I had heroin in my blood when I was born, and my mom, so I was in foster care until I was about a year and a half, but was reunited with my mother, so I have no memory of not being with her. She actually got me back as she started to utilize one of the first grassroots alcohol and drug treatment programs that cater to African Americans. And I always just like to share that small tidbit because that really kind of is the core of why I do what I do, because there were services and supports out there that helped my mother and my family. It helped me, and I was able to build resiliency, which I truly believe in. And it's my duty to give back, and it's an honor to be able to be a part of the system that actually helps my family and I.
I think that's so important, and keeping us on target and doing this sort of work. We don't do it for the money.
Right, absolutely.
Well, Ebony, tell us a little bit about your scope of work at Multnomah County as the director of the Behavioral Health.
Yeah. So in Multnomah County Behavioral Health, we actually are the local mental health authority for Multnomah County. And so what that means is that we have the responsibility for keeping our finger on the pulse in terms of understanding what the local need is. It's our job to make sure that we are coordinating with key stakeholders and also peers and consumers to understand the experience, to talk about what the current challenges and barriers are, so that then we can collectively develop local solutions and strategies that help us achieve the outcomes that we're looking for. And so in addition to that piece, we also have a responsibility for some key statutory required services that we are to provide. So we provide a myriad of crisis services. So for example, we operate the 24/7 mental health call center, in addition to the crisis services where, we have mobile crisis services, we have the urgent walk-in clinic, and I'll talk more about those shortly. We also provide commitment services, and then we also provide adult protective services. And so, for example, if you have a concern of an individual who's utilizing any of our services, whether it's on the substance use side or the mental health side, and you have concerns of abuse or neglect, then we take those reports and screen and investigate accordingly. And so, in addition to some of our commitment services and jail diversion services and things like that. And so those are a bulk of some of our required mandated services that we provide as a local mental health authority. In addition to, we also provide direct clinical services for children and youth. So we have our school-based mental health program. We have our early childhood mental health program. We also have our ESA program, which is a program for young adults 15 to 25 who experience their first episode of psychosis, in addition to our CARES Northwest program, which is a medically forensic program for children and youth who experience a wide range of abuse. So that kind of very quickly is a high level of what we do within the Behavioral Health Division. We also are connected to Health Share and Care Oregon, where we provide care coordination for older adults all the way to children and youth who are utilizing some of the intensive and higher levels of care.
That's a big basket of diverse tasks. How do you collect the right people to do all these things?
Yeah, no, I appreciate you asking that question. That's one of the things that I am proud of working and being an employee of Multnomah County, is that we really believe it's important that we have individuals that represent the community and the people that we serve. And so not only looking at it from a race or ethnicity perspective, also looking at it from a perspective of those with lived experience to match the community and the individuals that we're serving. One of the things that we've recently done over the course of the last 3 years was establish the Office of Consumer Engagement. That's where we have 2 individuals who sit within the director's office that have lived experience, and their job is to advise us from policy to practice from the perspective of those with lived experience, in addition to bringing forth the voice of the community that we're serving. And most recently this year, we added a leadership position to that also. But yes, we recognize that each individual is unique. And so we have to do our due diligence to ensure that we continue to diversify our workforce so that we can be effective in meeting the need.
I'll tell you, I go to policy meetings all over the county, and your staff is in every meeting. They know everyone.
Nice.
So let's do a little bit of a deep dive on a couple of these programs, because as I said, a lot of them, and they're very diverse and very different. Tell me a little bit more about Multnomah County and ESA.
Yes, absolutely. So ESA stands for the Early Assessment and Support Alliance Program. And that, again, is a program that caters to young adults between the ages of about 15 to 25, give or take. And that program is a program where young adults who have experienced their first episode of psychosis have the experience to get screened and enrolled to receive a number of different services. So in addition to just specialty mental health or group therapy or medication management, we also have a nurse practitioner that can help focus on the physical wellness aspect. We also have an occupational therapist who works alongside of our supported employment coordinator, to also look at how do we recognize and serve the whole individual. And so in order to have a sustained and viability in your life, you also have to think about employment. You have to think about education. And oftentimes, if you don't have employment, then that impacts where you can live. If you don't have education, that can impact the type of job that you want to get. So we try to integrate all of those key pieces into the ESA program. ESA is also a fidelity-based program. And what I will say too is that we have a psychiatrist also that also then works with the young adults to kind of educate them and give them the choice if they want to explore whether or not they want to use medication as a tool to help kind of manage and sustain their recovery. And really the goal of that program is to help kind of educate and normalize the symptomology, so that then as they go throughout their course of life and they start to recognize that, oh, I'm having a flare-up, here are the signs that I need to recognize, here are the tools that I've gained to learn how to continue to manage, so I don't have to end up going to the hospital or dropping out of school, so on and so forth. So in a nutshell, that's what the ESA program is.
The word I didn't hear you use is hospital. A dozen years ago, that's where we put people in their first episodes of psychosis. Why are we not putting people in hospitals?
Well, people are individuals. People are a part of our community. And in my opinion, and also what research demonstrates, is that people thrive the most when they're at home and when they're in their community. And so I think, if you go back and you look over the course of the last 30 years or so, you can look at the various kind of philosophies and models where there was a big push and focus around institutional care. And finally, and we still have a lot of work to do moving forward, there's starting to be this realization that that's not effective and that's not the answer. And so it really is looking at how do you serve the individual in their community with being able to provide and bring the supports to wrap around them so that they can thrive.
So that seems to be a big goal of a lot of your programs, is keeping people, not putting people in the hospital, but keeping people out of the hospital.
Right.
And so another one of the programs that the county supports is Project Respond.
Mm-hmm.
Tell me a little bit about what Project Respond is, and then also what's going on with Project Respond now that we're in the times of Corona.
Yeah, well, so what I'll say just briefly in regards to the times of coronavirus, one of the things that we recognize in Multnomah County Behavioral Health is that continuing to have access to services is crucial and critical, and oftentimes it's going to be a grounding factor to help support folks with getting through this unprecedented time. And so with that, we recognize that we have to be flexible, nimble, and adaptable in the moment as things change day to day, to ensure that we are providing services to especially the most vulnerable. And some of our core services that our most vulnerable individuals use is our crisis services. And so Project Respond is a program through Cascadia Behavioral Health, which we contract with, where when an individual is in crisis in the community, whether it's at home, whether it's at school, whether it's at work, whether it's in downtown Portland, wherever an individual may be, we're able to dispatch the team to go out and to assess the individual in the moment to determine what the need is, to see, well, is it that just someone needs someone to talk to face, and get connected to maybe the urgent walk-in clinic versus having to send them to the ED. Sometimes folks are in such crisis that they do need hospital level of care. And so with that, then Project Respond, really works from a trauma-informed perspective or lens, I should say, to then really looking at a strategy in the moment to then get the individual to the hospital so that then they can get that right level of service and support.
It's been a great program for many years. Another program that the county operates that is dedicated to keeping people out of the hospital and also making that assessment as to whether people need to go is the crisis line.
Mm-hmm.
And I have a lot of friends who rely on your crisis line. It's quite amazing. Tell us about how that works.
Yeah, and I think too, I'll say it's more than just the crisis line. It's the behavioral health call center, and so with that, you don't have to only be in crisis to access the services, and so that service and support is staffed by county clinicians, and so we've also expanded where we even have QMHA level or folks who have kind of lived experience and or can focus on just developing or working with individuals and walking through utilizing skills. And so we have varying levels of lived experience and professional experience that staff the call center, and their individuals are able to get an array of services and support. So it could be a mom who might say, I believe that my daughter is suicidal and I don't know what to do. From there, we're able to dispatch Project Respond if needed. Or it could be a school counselor who has a student who believes that the student is depressed and wants to just know who are the closest providers to the catchment area and how do I make a referral. It can be an individual that's experiencing high levels of anxiety right now in light of the COVID-19, and just they need someone to talk to. It's a resource and a support for someone who is in the moment, having active symptomology, whether it's just general anxiety all the way to suicidal ideation, in addition to resources for anyone that may have a client, a friend, a family member, and they just need some additional kind of guidance on how to navigate the system.
It's so important that it's not just the person, the identified patient, but you, the call center can take calls from anyone who has any question about how services work in the system, how to access the system. You must have a lot of training for these call takers.
Yes, we do. And so there's a whole number. So like I said, we have what we call QMHP level folks or master's level folks. So these are folks who actually are either licensed practitioners or individuals who have gone to school that specialize in either social work, counseling, but then in order to bring them on, we do some targeted training. So for example, we do training around suicide. So a lot of the folks are trained in mental health first aid. A lot of the folks are trained in psychological first aid, and in addition to QPR. And it's about knowing how to recognize signs and symptoms of suicide and or other general symptoms of either depression and anxiety. It's about, we provide training to our staff on how to support an individual in the moment versus walking a family member or a general member of society who might call up for support. And so we have varying levels of training that we do provide in the moment. And, outside of just those core pieces, it's also needing to know how to de-escalate in the moment. And the flip side of that is they have to have an understanding of the broad array of resources that we have in the community too, so that in the moment they can also get those folks connected.
So Ebony, that staff must take a lot of training. How do you provide training to your staff, especially around the call center?
Yes, because folks utilize us during very crucial moments in life, we have to make sure that our staff are well trained. We have to make sure that staff know how to support and guide someone who might be walking through suicide ideation versus major depression or high levels of anxiety. And so in terms of suicide ideation, there's a number of trainings that our staff go through. So for example, there's mental health first aid. And so just really making sure that our staff know how to recognize the general signs and symptoms of suicide ideation, because it looks different in teenagers versus older adults versus men versus women. And so it's making sure that they are fully trained in that area, making sure that they also know how to kind of connect in a trauma-informed way, just so that then we're not losing any valuable lives. It's also important that we, on the flip side, know how to support a mom or a school counselor or a provider that's calling in that might have an active individual that they're sitting next to. And so it's how do we support both the individual and then the supports around them. A lot of times, especially like right now, we see calls coming in when we are in these various kind of traumatic events that happen within our communities, and we're in one right now specific to the coronavirus. And so also we will have individuals who will call with just heightened anxiety and just need someone to talk to. And so we have some regular callers that use us for support just to be able to check in throughout the day. So it's knowing how to support people. And so some of the trainings that we give specific to that is psychological first aid. So those are just a couple examples.
So in this very difficult time, how are staff members taking care of themselves?
Yeah, it's about connection and support. And so, we also make sure that whatever we're trying to do in the moment to support the individuals that utilize our services, we equally do with our staff. And so because a lot of our staff are teleworking right now, I say that anxiety is high because, again, we're in uncharted territories. And so how do we provide services to those who need it the most while you're at home and you don't want to miss a beat? And I'm isolated, I feel disconnected. And so we're trying to be real intentional around how we're keeping our staff connected, how we're supporting staff. So we're using video conference platforms. We're doing various kind of web-based drop-in groups just to make sure that we're supporting our staff, in addition to just continuing to encourage them to take moments to practice mindfulness, to take moment to think about and reflect on the elements of gratitude in your life, to be able to not be overwhelmed by just this daunting crisis that we're in. And so, like I said, we're practicing mindfulness, we're working to stay connected, we're trying to be trauma informed even when we're working with our staff, and encouraging staff to read and to disconnect every so often just so that they can stay fully charged.
It's just being aware that trauma can occur to anyone.
Correct. Right.
Well, now we have a lot of people who have been traumatized and they need access to more intensive services. How are we doing with the hospitals and with Unity right now?
Yeah, well, what I can say and what I know is that hospitals still are open, and they still are providing services, and they still are doing admissions. The one thing is, on at the flip side, they're also preparing for the peak, and so trying to make sure that we continue to have access in the moment, and how do we prepare when things start to get to a place of gridlock if that happens. I actually facilitate a call twice per week with key folks within our system. So we have folks from Care Oregon, from the CCO. We have the hospitals on the phone. We have folks from the crisis system. We have key providers from the substance use side. And what we do is we kind of just do this rapid fire process where we're updating each other on kind of what the current kind of capacity flow is, and what are any of the issues in the moment that folks might be dealing with, so that then as a system, we can collectively work to find a solution in the moment, and or at least know what we need to be thinking about while we're continuing to plan and respond to COVID-19.
And so the capacity seems to be okay at this point. People are still able to get access to services.
Yeah, no one's being turned away at the hospitals.
That's quite amazing. And how about for what's changing with inpatient and outpatient treatment at this point?
Yeah, again, I think everyone's primary focus is on keeping the individuals that we serve safe, and keeping those who are serving our consumers healthy. And so, how do we practice the social distancing guidelines? How do we work within the current stay-at-home order, but work to ensure that we're providing the essential behavioral health services? And so I know that a lot of providers have gone to leveraging the technological capabilities to find alternative ways to provide service and support. So a lot of telehealth and telemedicine, or services and supports being provided telephonically, or through video conference platforms.
That's such a big shift, as we're used to the look and the feel and the smell and the body affect, and all these other ways of knowing how a person is doing, just being able to see them through this tube. It's a big change.
It is a big change, and again, it's how do you see the silver lining? And so I oftentimes reflect on where, if we were in the situation 20 years ago, we wouldn't even have kind of the current capabilities. And so it's this piece of, we can always think of the things that are causing challenges and limitations. And while we need to be thinking about that, how do we, again, at least we leverage, reflect, and appreciate what we do have at our fingertips. And on the flip side, what we know is, especially for those that we serve, there's a group of folks who don't have cell phones. There's a group of folks that don't have access to internet. There's a group of folks that don't have computers. And so that's one of our focuses, is really trying to figure out what is the right strategy to serve that vulnerable population, to make sure that they're getting service and support too.
So, Ebony, you are evincing a lot of the leadership qualities that we've been looking for at Multnomah County for a long time in the mental health division, because you're right on top of it. You know what's going on, and that's so new and fresh. How are you keeping your own spirits up? How are you keeping the spirits up of your staff? And then how are you moving that out into the community, so people maybe coming into the treatment services might have the faith that they can get better too?
I think globally, it's having intentionality around connection. How do we not lose the human touch among and amidst this COVID-19 crisis that we're in? And so again, it's easy to fall into isolation right now. It's easy to feel very disconnected and feel like things are so impersonal with services being provided over the phone. But we're really encouraging a lot of our staff to make sure when they can and when those that we're serving have the capability. Are you doing FaceTime? Are you Skyping? Are you leveraging the technological capabilities? Because it's amazing what happens when you can see someone's face. And so we're doing that same thing internally with our staff in the division. And so we're hosting these various web-based drop-in calls and platforms just so that then folks can stay connected, because you have to be able to process and debrief and just connect and see and hear each other to then get recharged to go on to continue to support others. And so it's this balancing act between making sure that we're keeping our staff fully charged and fueled and uplifted so that they can then go on to support those. But like I said earlier, I say the primary tool is about connection and relationship.
Well, thank you. This is Ebony. This has been great information about the Multnomah County Mental Health and Behavioral Health Division. Thanks for being on top of this. Thanks for your work.
Yes.
Thanks for joining us today.
Yes, thank you. And I just want to, in closing, remind folks that the best way to get support, the best way to find out what the current resources are that are available right now is calling our Multnomah County Mental Health Call Center at 503-988-4888, and it should be at the bottom of your screen. So thank you, and stay safe and stay connected.
Thanks, Ebony.
Thank you.